Welcome to the Pottstown Area Health and Wellness Foundation's webisode series on the opioid crisis. I'm your host, Beth Trapani, and in today's episode, Real Recovery Matters, we're talking about some of the issues involved with the addiction and also with recovery. And I'm joined by my guest today, Marlelle Fromuth, Director of Behavioral Health for Community Health and Dental Care, and also Christine Ellis. And Christine is Director of the Clinical Wellness Recovery Team for Creative Health, and both agencies service the Tri-County area. So let's just start by, for people who aren't very familiar, we hear the opioid crisis, but how does an opioid addiction begin, and why is it such a difficult and widespread problem?
I think a lot of people are hearing in the news that it starts with maybe an injury or some chronic pain, and they're given an opioid prescription, and then it may not be managed as well, and the addiction starts from there. We also have people that may be experimenting, and then there is the addictive process that takes over. Or maybe those that are dealing with some very difficult stressors, mental health issues, and they use drugs and substances as a escape. Many people are more hardwired to become addicted to substances, and that's where it's difficult, and you need professional help to intervene.
Okay. You've been talking about early intervention being such an issue. Christine, can you speak to that?
Yes, so I think early intervention, means a lot of different things. Early intervention can span, even the lifespan, going back to, for some folks, as Marlelle mentioned, who may be coming into the pathway of addiction from, perhaps having some trauma in their lifetime. Prevention could be, things like accessing services, screenings for trauma-related issues in even young children, and helping, pave the way into treatment for those children so that they can resolve those issues and hopefully avoid the pathway of addiction later on down the road. Other types of prevention, in the other example, like Marlelle had mentioned, of somebody having an injury and becoming addicted, prevention might look like, more education from providers to folks when those prescriptions are given, so that people understand the risks that are involved, and also close monitoring, so that if somebody does find that they're becoming physiologically addicted to a medication, the intervention can start sooner rather than later.
Okay. When you talk about childhood trauma, can you elaborate a little bit on that? What do you mean by that?
Many people maybe are hearing more about the ACEs study, but it still is not as mainstream. ACEs stands for Adverse Childhood Experiences, and there's a cluster of 10 certain childhood experiences that predispose people to maybe having health issues as well as difficulty later in life. And maybe things like physical abuse, parents themselves that are dealing with domestic violence, incarceration, substance abuse themselves, and these factors contribute to a possibility of having addiction and other issues later on in life.
Okay. And it's important to note that aside from just someone having an addiction issue, this is a physical problem.
Correct. It's a physical illness. We would treat it just like we would treat diabetes. And you want to monitor it, and it's a chronic illness that needs additional follow-up, and you need that support team. And we want to take the stigma away from addiction.
Okay, and there is a lot of stigma.
Unfortunately.
Do you find that people are hesitant to seek help because they're embarrassed, or they don't want to be associated with a certain group?
That can be one of the barriers, and I think the most important thing is having webisodes like this to educate the public, and the more we talk about it and make it more available and information available, I think we can start working on taking the stigma away.
Okay. This is really something that impacts all age groups, all socioeconomic groups. Christine, what's your experience with that?
So certainly we have seen folks, even as young as 12 years old who have had addiction issues, and we have seen elderly adults with addiction issues. So it absolutely spans the lifespan.
Okay. There's been a 300% increase in opioid prescription sales since 1999. Why is that?
Unfortunately, it goes back to some finger pointing and looking at companies that are marketing opioids, and also looking at pain and managing pain, and understanding that people aren't going to be pain free. It's finding ways to be able to deal with chronic pain, or if it's short term, having the appropriate dosage and monitoring. we tend to want to have a pain-free existence, and that was when they started marketing it that way. So that's why you're seeing the increase in medications.
What should someone do if they're prescribed opioids?
They need to have the discussion with their doctor on the duration, the frequency, what they should expect. There should be pain after specific injuries and illnesses. So they're realistic with what they can have, and also ask for other alternative pain relief methods. Christine can maybe speak to some of that.
Yeah, definitely. And also just the longer that somebody is on those medications to manage pain, especially in cases like chronic pain, the greater the likelihood that they will become dependent on the medication, physiologically. And, it's important for folks also to recognize that sometimes the withdrawal symptoms can mimic pain. So we can feel as though we have pain that's no longer coming from an original injury. So that certainly can keep things going and can contribute to the addictive process, taking hold for folks.
And very briefly, in just the few seconds we have left, these addictions can lead to death.
Right.
Yeah. So it's important for someone to seek help, and certainly both of your organizations can provide that help, and financial concerns are not an issue because both of your organizations work with clients. So we have resources on our screen. We encourage people to visit the websites, to call the phone numbers, and certainly if they are struggling themselves with an addiction or know someone else who is, please reach out and seek help. And for more information on this issue and more webisodes, please visit the Pottstownfoundation.org.